But Dr. Arora, you are now heading the apex body which has taken all the policy decisions when it comes to vaccination. 97% of Indians today are vaccinated. Again, another round of applause for that. How has digitization of health helped you reach this milestone?
So, thank you very much. So, this is an important question, and the brief answer is that pandemic was not taken as a tragedy but as an opportunity. And the preparation started somewhere in the last week of February itself. All of us knew that vaccines will be required. This important point was that everybody has to be immunized. And it means adult immunization. I'm a pediatrician, so pediatric immunization and maternal immunization has been there for 50 years. But adult immunization, and then 1.4 billion. And this couldn't have been possible because we have to manage, keep a record, and kind of remind them and see how many are immunized and not, in the context that vaccine was not freely available. There was a limited supply. So the preparation for IT-based solution started right in the first quarter of 2020. And by July, a very specific platform had started taking a shape. India was already using a platform to monitor vaccine availability at various points and cold chain. It's called EVEN. That backbone was used to get client information on that. As a result, we have COVID in front of us. But the most important part of the COVID is that it not only keeps an account of who has got the vaccine, how many doses, and it also sends you reminder, but it also has a inbuilt two additional mechanisms. One is, what is the amount of vaccine available at a particular center? This is real-time information available back-end. And the most important, and I think Dr. Babu and everybody will agree, what IT brings is accountability. You must have noticed in your immunization certificate the name and the name of the immunizing person or the vaccinator, date, time, and place is written. So if there is a problem, we know who was the person who has given the injection. And same philosophy is being followed up in all our programs now, that along with access, reach, quality, accountability will come in healthcare as we move into a digital health scenario.
That's very interesting. It's not just about dissemination of the technology and medicines, but also accountability. In fact, something that Mr. Babu had picked up, and I'd like to take that up with Dr. Ritu Garg as well. Telemedicine, something that has been mentioned. Now, when we see a rapid rise of that in our country, for example, in North India, about 80% of the doctors have been connected, 50% in South and the Western region, 35% in East India. How do we ensure that it reaches 100%, especially in the rural areas, given the importance of that?